Good evening, and thank you so much for joining this discussion from Healthy Heart Nation as it relates to adolescent health. The American Academy of Pediatrics is committed to addressing the factors that affect child and adolescent health with a focus on issues that may leave some children more vulnerable than others. And they have recognized that racism is a social determinant of health that has profound impact on the health status of children, adolescent, emerging adults, and their families. Although progress has been made toward racial equality and equity, the evidence to support the continued negative impact on racism and health, it does affect the well-being. And so today, what members of the Healthy Heart Nation ambassador team, specifically Dr. Nalo Hamilton, wanted to ensure that we addressed for the Healthy Heart Nation audience is we wanted to really focus on Black women health, and we were going to go through it from all stages as it relates to how we can become advocates for ourselves, how we learn to use our voices to ensure that we receive the best health. We get questions answered as it relates to the things that are going on in our lives. And so in order for us to do this properly, I have invited a special co-host. Her name is London Bryant, and she is my co-host for today. London, tell us a little bit about yourself.
Hello, my name is London Bryant. I am 13 years old, the youngest of 3 siblings. I am soon to be graduating the 8th grade, and it is my pleasure to be the co-host of today's episode. So thank you for me.
Absolutely. Thank you for being here. And there's no better way to teach someone how to use their voice than to allow them to use their voice. And so London has some questions for us, but we're not going to answer them alone. We have a panel of some fantastic women that we're going to bring to the stage right now. And we will go through and allow them to introduce themselves as well. So we'll start with you, Dr. LeCount.
Good afternoon. My name is Dr. Anissa LeCount. I am a family medicine physician, and I work locally, and I'm also faculty at the Kaiser Bernard J. Tyson School of Medicine, and it is my pleasure to be here and give back. Thanks for having me.
Of course. And so Dr. Hamilton, we'll go to you next.
Good afternoon, everyone. My name is Dr. Nalo Hamilton. I am a researcher and a women's health nurse practitioner, as well as being faculty at UCLA School of Nursing.
Fantastic.
So I'm happy to be here this afternoon.
Thank you so much. And so Dr. Hogan, you're next.
Hello, everyone. My name is Anjanette Hogan. I am a board certified pediatrician and in my own private practice in Gardena, California.
Fantastic. All right, ladies. So we're going to get right into this. And London has some questions that she has prepared. And so we're going to have her go ahead and ask those questions at this time.
Okay, so my first question is for Dr. Hogan, and it is it unsanitary if you don't shave your underarms or legs?
Hi, London. That's a good question. No, it's not unsanitary per se if you don't shave at all. You just have to be a little bit more consistent with proper hygiene, usage of deodorant, and keeping all areas that are covered with hair groomed properly. But there is no adverse effect to hygiene if you choose to remain natural and unshaved.
And I'm just going to add, I'm just jump right in and say, properly, as far as hygiene is concerned, that means taking a shower every day, If you've started a menstrual cycle that we may or may not talk about, making sure that you're very hygienic on those days, because sometimes, things change throughout the month as far as discharge and vaginal discharge and having a menstrual cycle. So it's just very important that you use the deodorant, as Dr. Hogan said, and that you're trimming and all of that. And it's not unsanitary, it's a choice. And it's also a conversation you can have with your parents or your older sibling. I'm just wanted to make sure that the hygiene part, that we know that means that put some water into places, put some water into places that need water.
Put some water and some soap.
And don't forget the soap.
Thank you, Dr. Hogan. And some soap.
That's important. I get that question. That's a good question, London, because I get there's a big difference between the generations on what's considered hygienically sound and what's not. Yes. So a lot of my younger people that are London's age actually tending towards not. Mm-hmm. It does lead to some medical complications, though, London, if you are not using soap and water and grooming, and I have to treat those. But a lot of the moms come from a different time, so they equate hair with it not being sanitary, and that's not necessarily true. You just have to make a little bit of an effort to do some extra things, as Anissa said: water, soap, trimming. Proper undergarments in certain areas, because the excess hair can get pulled and cause problems, just like proper brassieres if you're using a bra that won't pull on the hair and things of that nature. But it is a question that comes up a lot now, and I think that's more generational. So I actually answer that question a lot more for the moms, because the moms not. And I have to give reassurance that it actually is okay if they're up to do all the proper hygiene.
Right. And that does kind of come to preference, right? Because how Definitely. We were raised in our generation, right? So I'm like big on that, like, oh no, man, you wearing a tank top. Can you please go do something with that? But it is really a preference, like you said. And so, as long as they are washing and keeping themselves clean, I'm gonna have to just let go of some of my issues. So thank you all for that.
And regarding the proper undergarments, that may be different for each person. Sometimes people have irritations on their skin depending on what the proper undergarments are. So you're going to have to work with your guardian, your mom, your parent, your dad, your older sibling to figure out what that is for you. It takes a little while. And I think growing up, you thought what your mama had or your friends had is what you had to have. And if it didn't fit you right, or if it wasn't working right, then, something was wrong with you. But that's not the case. We're all very different. Mm-hmm. And so we have to figure it out. So I'm gonna be quiet and let you answer the next question.
Okay.
Thank you so much. My second question is for Dr. LeCount, and is, what age should I expect to start my menstrual cycle?
Well, the menstrual cycle is the average age is like almost 13, 12 to 13, but we're really not concerned, as Dr. Hogan knows, that you can be all the way up to 14, 15, depending on how athletic you are. Being very active kind of delays that for some girls. It's always, if you're having questions about it, it's always very important to go to folks like Dr. Hamilton or myself or Dr. Hogan to ask the question, because that's not something you always know. When you start your menstrual cycle, we call it menarche, and it's a fancy name for when you start. But women that are older, we have the same question, because when your menstrual cycle stops, we're like, when is it going to stop? And it's different for everybody. And so we just have to learn at your age, London, that you start asking the questions early. So when you get to be my age and older, you can continue to ask the questions, because there's going to be questions along the whole journey. So I hope I answered your questions. It's about 13 is like the average age, but we're really not that concerned unless you're past like 15 and a half, 16, and you haven't had any issues there. But I'll let Dr. Hamilton and Dr. Hogan chime in as well.
Well, I know it really has changed. I know, because I see children all the time, because that's all I choose. And the average age has actually moved down. So I have a lot of girls as young as 8 and 9 starting their cycles. And the parents are coming thinking that it's too early. So they want them tested for all this early. But what I usually talk about every time that my children have their physicals, London, and I'm sure you've had a million physicals with your doctor, we take a look. They should be taking a look at your entire body because there are certain things we see as far as your breasts, your underarm hair, your genital hair that can give us an idea of when you in particular are coming close to starting your menstrual cycle. That has changed a lot in my pediatric population because most children have a little bit more weight than they should have. And when you have extra weight, sometimes you do enter puberty early. So you might be like Anissa said, you might be very athletic, a swimmer, and you might start yours later, but you might have a young friend that, you know, likes to stay more in the house and maybe a little bit more curvier, and they may start theirs a little bit earlier. And that just has to do with the effects of the extra weight and things and how it's making their body go a little faster. So it really is an individual thing. And as Anissa said, we don't get worried at all. And I reassure all my young ladies until they start to push towards 15, 16. But it's a combination of what you look like, what kind of food you eat, what kind of things you do as far as activity. And when you go to your doctor, we take all that into account to just reassure you as an individual that you are okay. And I strongly just encourage my other children not to compare themselves kind of to their friends because I can't see their friends. A lot of times I tell them not even to compare to siblings because siblings are all shaped different and all bodies are all responding different. So it's a range of ages now, but we don't get really do anything else as far as talking about it unless you make it to 15, sometimes 16, and you have not had your period. Also binding that I tell parents, a lot of times young ladies can have menarche, which they'll have some bleeding, and then for months there's nothing.
Okay.
So they don't know if that counts or it doesn't, and it does count. It takes a while for some girls to have a regulated menstrual cycle. So I do try to tell my parents, because I have some moms come in, well, she had one and now she doesn't have anything. What's she doing? And it has nothing to do with that. It's just a variation. So some girls have already started, but they're not counting it because they just had some dark blood in their panties. And that was like 3 months ago. But that actually is part of the whole process. So that's why it's a varying in age. But every time you go to the doctor for a physical, that's part of your overall health. So it is my hope, because I speak about that the doctors talk to you about that part of your development so you can ask them any questions and feel comfortable with where you are.
Okay. Dr. Hamilton, did you want to add anything to that?
I'm usually dealing with young ladies on the opposite side of the spectrum that haven't started their period. And they're older, or the ones that are having periods too frequently. And so there are other things that I have to negotiate with those young ladies. Sometimes it is, as Dr. Hogan and Dr. LeCount said, that how early they started, what does their body look like? Are there other challenges? I'm also dealing with young ladies who may have a pause because of other things that are taking place with them. So we have to look at medications they might be on for other situations. And so it's very important for young ladies to know to ask the question, because everyone's going to be individualized. And I think that's the biggest takeaway, because there isn't a one piece or a one size that fits all. There's just not one age that everyone's going to hit it. And it changes. I was one who didn't start till much later. And I was like, hip, hip, hooray. And tell all my other friends. And I was like, something wrong with me. But it just depends on where you are.
Right.
No, absolutely. And so as a parent, when you're going in with your daughters and they're getting those checkups, I mean, are there, other than, hey, is everything looking okay with her at this age? Or what kind of questions from an advocacy standpoint as a parent should we be asking around that whole menstrual cycle?
Most of the time, the parents ask, well, I'm very proactive because I kind of get the sense that sometimes parents don't know what they should be asking. So I usually, once it's over and I give all these different sayings, they'll go, oh, well, you answered everything. So I know that parents want to know the attitudes. So a lot of times young people, tweens, will all of a sudden, and I can see it just physically when they walk in the office, they went from like ponytails to, hey, Dr. Hogan, till everybody gets on my nerves and they have an attitude, or they the parents notice that they're not listening, or that they're having some getting tapped on the shoulder in school. So and that sometimes for some girls starts before the actual blood is seen. And it can become cyclical, and the parents are like, she just starts crying, for nothing. And so I try to address that's something to look out for.
Okay,
Also,
so the emotional status of the child, how it changes.
And that everything is about me. Why me? They don't want to talk to me. Nobody's my friend. You, especially when there's other siblings. Oh, such and such gets to do X, Y, and Z. And let them know that will level out as the menstrual cycle starts. I always reassure parents and inform parents about the possibility of skipping months or having 2 cycles in 1 month when it first starts, because parents will go ballistic if a period comes and then it stops. Because they're only thinking one thing.
Right.
And then I talk to them about, I always talk to parents, because in most times when they're just entering puberty, I ask, one of my things is when parents want to know, I say, well, when they go outside and they come back in, does it smell like onions? Because there's a time when your young child can go outside and play and come back in and not smell. But when they come back in and they're musty, that means they're entering puberty. So these are things we tell parents. So like, and the parents will go, oh, and sometimes that happens at 7 or 8, that just early adrenarche. And it doesn't mean the period's going to start. It just means, hey, they're revving up. So I do let them know about, using, we talk about shaving at that time. We talk about use of deodorant. We talk about, are they getting a little bit of acne? And then as far as the actual bleeding themselves, I ask moms, have you noticed a little bit of discharge in the underwear? It shouldn't stink. It's usually kind of just white. That can come before. Then it will get darker, then you'll have blood. And so I try to give them kind of months how that will occur. So things to look for. Usually I'm pretty right after 20 years, because they'll come back and they'll swear I jinxed them. And I'm like, nope, I told you when she was here, this is what's happening. Because, just in case, I always go, you might want to let them pick a little pouch. You might want to decide if they're going to use a cup, or if they're going to use the panties, or if they're going to use a sanitary napkin. This might want to be when you want to start them, because I can't predict where they're going to be. Right. So we talk about having them prepared, having the little bag in school, letting them know what to do if it comes. So we talk about those things. And I have those conversations as early as the 9-year visit, because like I say, I do have 9-year-olds that have started their menstrual cycle, which is quite difficult, because that's still a young mind. Exactly. And when you talk about the hygiene and changing and things like that, it's a little bit more taxing than when they're 12 and 13 and 14 and they actually kind of care about what they look like and what they smell. It's a little bit easier. So as a parent, you just kind of ask, I've noticed a change in the attitude. Is this going to stop? Or, I tell parents sometimes ask, do you have any books you recommend that are in kind of a simpler term? And I give them websites and things like that.
Right. And I know we're gonna move on, but this topic is so interesting to me because, I can still remember when I was like 10 years old, that's when I got mine, and reading the Judy Blume book, Are You There, God? It's Me, Margaret, and all those kind of things in terms of, just getting prepared for that. But how, in terms of like some girls, young girls, they get their periods and they immediately start to have horrible menstrual cramps, right? And so what kind of recommendations do you all offer? And I'll start with you, Dr. Hamilton, on this one, in terms of how they can relieve some of the pain and stress of menstrual cramps.
Water.
I know
it sounds real simple and cliche. Yeah. But it's water. If we look at our young ladies, and we even noticed that as you get older, our children don't drink enough water. And ironically, if you drink water, which, I got one, young people, though, like, oh, I drank 2 today. And I was like, it's like having all your cousins over and you have this big meal and you got to wash the dishes and all you have is this little itty bitty sink. So is the water going to stay clean or it's not? And so for young ladies, it's very important to drink water. 6 bottles, 10 bottles is what I prefer. And then if they are having a more pronounced rhythm, if you will, parents and the young lady start knowing, I start getting cry ears, or I want to sleep, that type of thing. That's when they really need to pay attention to their water intake and make sure it's high. Sometimes I even tell them, if you are really in tune with how you're starting to change, 2 days out, maybe you might need to start taking the Tylenol.
Okay.
And then to help with that, some of my young ladies, depending on how regular they've been, when I'm dealing with my young ladies who are 15, 16, 17 years old, they were hit and miss, and then all of a sudden it changes about 14. Then I say, well, maybe we should start with naproxen, because and that will start 2 days before they know that their menstrual cycle is going to come, their menses is going to come. But by and large, water, if you think about it, it is a process in which something is being eliminated out of your body, and it needs fluid. So if you don't have the fluid, then it becomes a lot more uncomfortable. I know that's easy, but really, just drink it.
I don't know if I've ever heard that before, but that's fantastic. Okay, London, I'll let you ask the next question. Go ahead.
I was going to ask that relates to this. What if you like miss months? Like it comes in patches or like different things like that?
Well, first and foremost, we have to make sure it depends on a couple of things, Miss London. So if someone comes to me for that and they are honestly not sexually active, that's the first thing in my office, if you come for irregular menstrual cycles. And even if you tell me you are, I'm still gonna give a pregnancy test. I'm just gonna do that. But there are other things that we ask, has it always been? Because some of my patients are what we call regularly irregular, and for their entire life, they're going to have this cycle that comes and it skips 2 months, and then comes and then skips 2 months. And then we deal with that. If it's all of a sudden, for some reason, irregular, we talk a lot about what's going on. A lot of girls from the pandemic and the depression and the stress and the anxiety has thrown their menstrual cycles off. So we talk about that. And then we also, in my office, I get a lot of different blood work to make sure the thyroid is okay, to make sure a lot of girls, well, people in general, again, because of the pandemic, their vitamin D levels are super low. And so this is affecting them. So so we kind of go in an order. But a lot of girls are now irregular because of the stress and what they feel and the anxiety of the pandemic. So some girls were irregular and now it's becoming regulated. As a final note, like Dr. Hamilton mentioned, if the girls are athletes, or if this becomes a problem and everything is negative and they're not pregnant, then that's when we can have them consider if they want birth control, because some girls are so sporadic, and I have some AAU basketball players and things like that. So we consider talking about that and the benefits if they have any other things such as bad cramps or acne, that it would help as a whole. So it just depends on the background to the story, because it can range anywhere, London, from being that's just normal for London to it being something that we need to fix with medicine, or something that we just need to have you help to decompress.
Fantastic.
What do you think about it, Dr. LaCount?
I don't have anything to add. I think Dr. Hogan had covered the whole gamut. I don't have anything else to add.
I'm sorry.
No, that's good.
Oh no, I'm loving it. I'm loving it. I'm just gonna sit here and wait for the next question.
Okay, so my third question is for Dr. Hamilton, and it's, should you use pads or tampons depending on like what age you are, ranging from 8 or to 20, whatever.
So this kind of goes back to the grooming question, London. It's up to you, honey. Some young ladies are more comfortable with sanitary napkins. They're not going to let them go. They like to see them. They like seeing the big stack, and they don't mind. There are some young ladies who want to be as discreet as possible, and so they prefer tampons. It goes to what are you comfortable with, because placement is different depending on a tampon or a sanitary napkin. I think it was Dr. Hogan that talked about the cup. Some young ladies don't want to use either. They just want to use the menstrual cup. So it depends on what you have. And I think that's a conversation that also needs to be had with your guardian. It needs to be had with your provider, and it changes too based on the community or your home community. If your mom or your older sister always use pads, more than likely you're going to start with pads. If you are an athlete, you're probably going to lean more towards a cup, or you're going to lean towards a tampon, because pads can, don't always sit where they're supposed to do, depending on the activity that you're doing.
Right.
If you're a swimmer, especially my swimmers, we have to work on if tampon placement. I actually help them place them while they're in the office, so they can get an idea of what they need to do. So it depends on you, your activities, and your home environment, which one you pick. So, and it can vary. You may prefer one at one time, but then if you have a different activity, you're going to switch to another one.
Dr. LaCount, I know that you're a family medicine doctor. So when you have patients and stuff, do they usually use pads or tampons?
So my patients usually use both. Some will use pads, some will use tampons. And the nice thing now is that there's been more attention to the needs of females, and that we're all different sizes, and we can't wear all the same size pad, and they don't all need to be shaped square, and all the tampons aren't just one hard cardboard spongy thing. They have them where they're shaped different now. They have them where some are thinner. They have them where they actually go through the process of when, if your menstrual cycle is heavy, you use these two, and when it gets lighter, you use these three. And so you really do, and they do that with the pads too. I discovered in Target that they now have these that you put on, that for my young girls who are just starting out, who are having a problem with, kind of remembering or scared at school that they may leak. They have the ones, they're not the pins, but they're the ones that you can put on and you can throw them away. And they're the little sanitary panties, which I think is, I don't know why I didn't think of that, because we had the pins all this time. But I think that's just wonderful. And it gives a whole plethora of just different opportunities for you to kind of fit and see which one fits you both. And so I hope you're getting out of this, London, that it's not one size fits all, that it's okay to be different. It is okay to choose things different. And you need to make sure that you have a conversation with somebody which I'm hoping you can have the conversation with your parent, if not your older sister, a sibling or cousin. And if not, that you feel very comfortable with your doctor asking those questions, because usually all of us that are providers usually have a moment in time where we just are in the room with you and we can talk to you specifically about your concerns, so you can feel comfortable to build that relationship with us and come to us. Because I tell all my adolescents, my tech, don't go on TikTok. Those people don't know what they talk about. Just call me. Some of the people know what they're talking about, but you need to be a professional that's telling you how to do things. The people who go and say, oh, this is how you do it. If you do it this way, then it's not going to happen. Don't listen to those people. You need to ask the professional, ask us, because we're basically very transparent, very honest. And so if I really answered your question, they use both to answer your question. But the nice thing is that there's so many products out there that you can choose from, that you're in a much better place than I was when I was your age.
And so, Dr. Hogan, what do you say to parents who believe that, that if only a child or a youth who is having sex should be using a tampon? The tampons shouldn't be used by younger people.
Earlier, of course, I tell them that that's not true, right along with the people that bring their children to me because they want me to tell them that the child's a virgin. That doesn't exist either. So I think because I've been doing it for 20 years that the parents have shifted.
Okay.
So a lot of the parents now are they're a couple generations removed. So I don't have to defend that a lot anymore, because I think they understand that that's not necessarily true. Every once in a while, I have one of my young patients that's raised by their grandmother or
Mhm.
maybe a foster parent. And so maybe a little bit older. And so I have that conversation. And then that's when I explain to them that it has nothing to do with the sexual activity, especially like Dr. Khan said, with the small, there are some that are very small. So they make appropriations now to be gentler to virgins. And so it's not necessarily true. And what I have noticed though a lot is that a lot of the younger people, just like the change in the thought process about shaving, a lot of them come to me, and I've had to find out a lot from my OB friends in regards to the menstrual cup situation, because a lot of my middle schoolers and high school, well, middle schoolers now want to use the cup. So now it's ensuring the parents that if they walking around, because the moms are not on board with you walking around, in their mind it's like a teacup full of blood.
Yes.
And they're like, that's gonna stink, and so that's more surprisingly what I educate on now, quite honestly, than a tampon and virginity. That was a few years back. Now we've moved into, I'm not doing that cup, and they're gonna walk around holding that stinky blood. And so
well, can you educate us, because I'm not familiar with the cup? If you could, like, what would you tell those parents about?
Well, I'm gonna defer the cup first to Dr. Hamilton.
Okay.
I'll tell you what I tell them, but just as far as the logistics of it, she would probably be better, because even when we talk about it for instruction, I still usually defer to the women's health side.
Well, let's go to her on this now.
Yeah.
Let's get her in now.
So the cup is a small device, probably about that deep, that wide, and it's placed back in the vaginal vault around the cervix, so that the cervix slightly dilates when you have your period in order for the endometrium of the uterus to come out and then evacuate the body to leave. So what the cup does is it sits there and it catches it. And if you have it in an appropriate placement, then everything goes into the cup. And then when the young lady goes to the bathroom, she can remove the cup, empty out what's there. If she wants to swish it out with some water, if she has some in a which I advise is take your own water bottle, swish it out in the toilet, and then you can reinsert and keep going. And so you do that. A lot of the young ladies now are like, I don't want to contribute to waste. Right. So this is reusable. So all they have to do is go to the bathroom, remove the menstrual cup, drop out the contents into the toilet, swish it out with some water that they bring with them, that they're not walking to the sink. That's the other thing. I have to remember that, because logistics are important. You don't walk to the sink and get it. You go ahead and then you do that. And so you have little cup holders that you can take to, that you can have multiples in your bag if you like. And that goes around. If it's placed similarly, if you place a tampon, you place it properly, right, towards the back of the vaginal vault, close to the cervix, you don't even feel it. Yeah. But the young lady has to be on, she has to be willing to, she inserts it, she removes it.
And that's what I stress. That's the main talking point I give to the parent when they ask about it. It is a level of responsibility that they have to make sure that their tween or teen has, so that they will not be concerned with the usage of the cup. Kind of like when you leave your boy uncircumcised. There are things he got to do with that when he grows up. So I try to say it both times, because sometimes parents can be a little bit more closed down with their female children. And so I use that as a kind of a comparison. They just have to have that gumph to put it in and bring the water and clean it out, because if they do that, then like she said, it's no different than the other methods.
Okay, fantastic. Thank you. I appreciate that.
This one's for Dr. Hogan, and I was wondering, when developing at a young age, is having interest in sex or sex thoughts a bad thing?
It's not a bad thing. What I always try to discuss in that situation with my parents, most of the time though, the parents tend to step out, which I encourage parents to keep the lines of communication open at all times. But What I like to distinguish for all my young people is the difference between having feelings of intimacy and romance versus straight sexual physical feelings, because we have to kind of dissect, and I tell them to give me examples of what they're talking about. I also have to really drive home more frequently now that what they are seeing on the internet is usually not healthy sexual relations. When it comes to kind of explicit things that young people, you guys get a hold of, or if we talk about pornography and things like that, because the honest truth is that's what most of you guys are asking about, because you've got a little hint of some type of pornography or sexually explicit, and that's the far end. So to answer your question, interest and curiosity about sex at any age and any person is never to be termed bad. It's just to explore what is it exactly that you're trying to understand. Are you trying to understand that this person makes your tummy feel crazy, or this person always makes you want to smile? Or have you began to explore yourself and got some pleasurable feelings from self-exploration? Are we talking about a physical, a sexual feeling? And so that's another conversation I have quite a bit, because unfortunately parents don't want to have that conversation. But you never, sweetheart, want to put that term a bad thing. It's not. It's just a question. It's a feeling, and it's something that you need help discovering. So as Dr. LeConte said, I always encourage my parents to have these conversations and be open, because we know, London, all of us on this call know that you guys are getting constantly inundated with sexual features, sexual songs, sexual clothes. So it's quite obvious that we know you would want to have questions, and that's okay. So I really encourage, if it can be, but from an educated source, again, like Dr. said, an educated resource. Don't Google nothing on TikTok, or I've had questions very recently about the use of sexual toys, and he was 13. And I answered his question, and I answered his question honestly. So hopefully you can talk to your pediatrician, or you could talk to your guardian, or you could talk to your parents. But no, those questions are not bad. Having those feelings is not bad, and it's actually quite normal. And those feelings occur in different people at different times. And sometimes you may have those feelings towards a good girlfriend, and sometimes you may have those feelings towards your male friend, and that will leave you confused. And that is when you need to ask questions and get reassured. So no, don't ever equate that with a bad thing, because it's not.
Fantastic.
Okay, this question, thank you so much. This question is for Dr. LeCount, and it is, what age do you usually have breast development or growth?
Well, that's just like the menstrual cycle question, I believe. We're starting to see breast development a lot younger than we were seeing it prior. We know that there could start pre-adolescence, and so that could be as young as, like Dr. Hogan said, like 7, 8. I think I had a 7-year-old, and the mom came in. She was like, "I don't know what's going on, but you better fix it." I said, "Oh, I can't fix it." Can't fix it. But that is when you start to see what we call, we stage it in the medical field as Tanner stages. And so as you get older, your breast will continue to enlarge, and the areola, which is the darker part, and the nipple will become more pronounced as you get older. And that actually changes from adolescence after you have had a child. That even changes, and the breasts enlarge even more then. So that it's around 8, 9, I would say, is the average. I don't know if my colleagues on the call have anything else to say. And I will say, everybody's different, okay? So you're not just gonna start growing and all of a sudden you're gonna be able to wear a size C. And you may want to wear a size C, and you may never get a size C, but it's your DNA. It's your DNA. It's your mama, your grandmama, your daddy's grandmama, their grandmama, that's gonna help to determine the size and how large you will be. And so there used to be shaming back in the day if you had smaller breasts, or if your breasts were too big or were larger, that people automatically made assumptions about how you were and who you are. And so you need to be proud of your body, no matter which side of the coin you're on. But the start of it itself is around, I would say, 8 or 9. And I encourage my colleagues to jump in, add, correct, edit, whatever I've said.
That's it. And I always I make one stipulation when parents, because I have those moms that come in, it's like, this is not right. And I always try to point out for Danette, if as a parent, there's a difference between actual breast tissue and fatty tissue.
Right.
So
Yes.
we have to go over that, because 1 in 5 children is overweight, 1 in 3 is obese. So we have some bigger kids now, and I have to sometimes reassure that the 6 and 7-year-olds, that's because they like milk and you let them eat.
Yes, I was going to say something about that. Right.
That doesn't have to do. So we always, London, a lot of times when you might have to lay back on the table and the doctor may touch your breast, that's how we're trying to, assess what's actual breast tissue. So that's sometimes, and the other thing I always encourage, as a mom, if you have women, moms need to be comfortable and actually understand what a bra fitting is. Take their time to get a bra fitting, because all these Target and Dollar Tree bras that are coming in my office, hanging on a wing and a prayer, London, you need to make sure you understand the point of the bra is to give your breast uplifting support.
Right.
So if you happen to be a fuller breasted girl at a young age, you might not be able to get your bras from Rainbow. You might have to go to Kohl's or somewhere and have somebody, or, in the mall, and have them tell you what size and get bras, because a lot of children, a lot of girls, they have more back pain. The combination of larger breasts plus being bent over always on their phones is causing a lot of back pain. So I do a lot of, when my girls are getting dressed, when the physical is finished, I go and adjust those straps, and then the breasts come all the way up. And they're looking at me. I'm like, yeah, I don't know what you exactly had going on right there. This is what it's supposed to look like. And sometimes I've had to tell mom, when you leave today, I know, you might not have a lot of money, but we might want to get her at least one, because this one isn't fitting, right. So that's another thing with breasts, that hopefully you're being able to tell the difference between actual breast tissue and just a little bit extra weight. And if you are more well endowed, just feeling comfortable with making sure you have the right support.
And I'm just gonna co-sign on that, is that I'm glad that you do that, because I'm one of those too. But it's really, if you are someone that's more endowed, there is sometimes this instance that they want to cover up and they want to shame, and they are bending down just because their undergarments aren't appropriate, right? So it makes them feel more self-conscious. It makes people feel wanting to be less involved, because they're trying not to bring attention to themselves, because the breasts bring attention to themselves. And so if we're able to really help our young women really understand that undergarment piece, I think it would help them with that confidence and help them be even more involved. Because I've had to talk some of my young ladies off the ledge, like, yes, you can run. Yes, you can be a part of that sport, but no, everybody's going to be, no, we can get the right stuff. And then talk to the moms and the parents about this. These are the things that we're going to do to help support this young lady, so she can do the things that she can, because then there's that inactivity. Then there's that more weight gain, then there's the more breast. So, helping them to understand that. So I applaud you for bringing that up, because I think that's vitally important.
I just want to add one more thing, London. You need to get fitted for your bra every year. I think that some people forget that. You should always get fitted annually. So it's kind of like you go in for an annual exam. You should have an annual bra fitting, because you never know, it can change. And so that bra, your favorite bra that you've had, that's now 18 months or 2 years old, it's not doing what it's supposed to. Like Dr. Hogan said, she has to go in and cinch it up, and we cinch it up, and we realize, like, no, you need extra. Every year you should get a bra fitting. So your guardian, your mom, your sister, if they don't do it at Kohl's, go to Macy's. They do it for free. You need to be fitted, because as Dr. LeCount says, your proper undergarments allows you to maintain activity so that you don't feel self-conscious, so that you can play in the sports. You're not uncomfortable, and things don't hurt.
Right.
Yeah. And it goes up and down depending on your weight. Exactly.
Yes.
Oh, absolutely.
This question kind of had to go with it still. What's really the difference between a sports bra and like a regular bra? Like what's the difference between that?
Well, I'm going to ask you real quick. What do you mean by regular bra?
Like the a regular bra, like not sport, because like there's sports bras and then there's just like bras that you may wear to work.
Right, like the sports bras are like the ones you wear when you're working out, right?
Yeah.
So
Well, they
they're
used
not
to
really
be
like strap, but yeah.
It used to be like that, but as someone who works out twice a day and runs marathons, that has changed totally.
Okay.
I think kind of what she's thinking is the basic difference back when is a bra that she thinks like you wear to work would have maybe underwire or it would have lace or it would hook in the back versus they think most people think sports bras you just kind of step in or put over your head. But that's kind of what young girls, because when young girls come in my office, they'll have on what she's saying, a sports bra. And in my mind, the reason I'm not advocating sports bras all the time for younger girls, London, is because the ones you guys get tend to just be the band straight across.
Yes.
And there's no support. There's no way for you to adjust. So sometimes you guys come in and it's too big or your under boob is hanging out. But there are, if you like that softness and that comfort, there are sports bras that have cups that hook in the back and have strap adjusters. So technically they can be one and the same.
Yes.
You just have to buy the correct one. But I think what she's thinking, Nalo, is just kind of like when girls have like basketball shorts on and like the uni kind of bra, because that's what most of the young girls, if they have a sports bra, they come in. And then I do make this recommendation to the parent if they like the soft feel, and because you can get a very supportive sports bra without underwire. A lot of young girls don't like that underwire, but they champion, and all of them, they have cup separation, they have uplift, and they have strap adjustment, but they're just still that soft kind of jersey spandex material. So sweetheart, if that's what you prefer, and they actually will be in the same bra section when you go in Macy's and you go to Kohl's, Champion, and everybody makes those. You just kind of have to look through past the one that's just straight across. But you could wear that if you were just going to school or if you were just going to play outside. The basic thing is we want you to have proper uplifting support and be able to adjust for increase in your breast or if you lost a little weight.
And I also wanted to make sure, because regular bra, you have the bralette now. So it again doesn't have underwire, but it's not what you would consider a sports bra,
right?
But it does have the cups in it. So when I guess I'm being a little too literal, like, which one do you mean?
I think she just means the kind of one that looks like old school, where you just put it in your
okay, that's the case.
Because that's what most girls. I get asked that question by the moms. Can you tell her to put on a regular bra? And I'm like, this is a regular bra. And I get that question a lot more now because of the, I guess we'll say, the gender flux.
Okay.
So there's fuller breasted girls who are expressing themselves in a maybe fluid gender. So they might come in some days and feel more as a male. And so they think they don't want to wear a regular bra, but they have larger breasts. So the mom wants them to have support, but they want to stay in a softer feel. So that's how I tend to have the conversation of what they think is a regular bra versus not. So I'm pretty sure that's what she's talking about. And then I redirect to something because the parent's just like, well, I don't care if she's fluid. I just need this sagging. I need this to stop. So we talk about getting, getting the breast, the softer material, but it lifts and stuff like that.
Well, in that case, London, you have multiple options. You have your bralettes, you have your bras that feel more soft, a jersey. They can either clip in the front, clip in the back. You have those that have a clip, and then you can have a Velcro in the back to hold it, whichever way you want. So it just depends. But as Dr. Hogan said, we need lift and support.
Right.
Because
that's all we care about.
There's muscles that are attached there that may not, with a lot of activities, soccer, track, volleyball, basketball, just a whole lot of work. the muscles in the breast area are not going to be happy. And so
and especially, honey, if you get your cycle and you're an athlete, because you can have breast tenderness. So you want a bra that supports you and clamps you down. So if you happen to run track or do the long jump and you're on your cycle and your breast is, you don't want nobody touching you because it's tender. So you need those goodies snatched down and supported, but you want to be comfortable. So that's when you would consider the sports bras that look less unilateral and just have certain definition to them. It's kind of, you're in a good place, London, because you got your choice of bras, sanitary napkins, tampons, cups. You running the world. You running the world. I feel like back in the day, we're still rolling up that car window. You got all.
Listen, that part right there. She got all kinds of.
You want whatever.
Thank you so much. This next question goes to Dr. LeCount because, again, like she's a family medicine doctor and she has younger kids and older kids. So, like, how do your patients communicate with their parents about changes that they don't understand in their bodies?
So, if I'm quite honest, they don't always communicate the changes that they have in their bodies, and sometimes they have to bridge that conversation. But I always encourage them to be as transparent and as comfortable as they can be, answering the questions. Changes in their bodies, meaning their weight, or what do you mean, London?
Like development in certain areas, maybe, things like that.
Okay, so if some of my patients have questions about their bodies, meaning they feel like their stomach's too big or their thighs are too big, or their breasts are too small, or just not necessarily understanding or being happy with what they see in the mirror. Some of the things I do is talk about your self-worth, your value, and self-love, because everybody's going to be different. One of the things that's been paramount and that's been constant in our conversation this evening is that everybody's different. Absolutely. Everybody's going to need something different, and that's okay. Individualism and getting something that's appropriate for you is okay. So I'm not sure if I'm answering your question all the way, but hopefully you're understanding. And if you have some clarifying questions for me, I'm happy to answer those, London.
That's good. What about Dr. Hogan or Dr. Hamilton?
And you know what? Before we elaborate on that one, we only have about 8 minutes left, and so I wanted to make sure that we could at least maybe address, from a mental health standpoint, what are you guys kind of seeing in terms of your patients and some of the issues and concerns that you're seeing and how you would counteract those. So we'll start with you, Dr. Hamilton, with the mental health issues.
Everything.
Okay.
I'm seeing everything. I'm seeing patients that are more anxious. I'm seeing more patients that are depressed. I'm seeing patients that are anxious and depressed. COVID has been a very interesting time for my young ladies. Some didn't realize how much they needed those social connections, and being on Zoom and not seeing their friends was difficult. The other thing is maybe some of the home environment wasn't as great. So going away to school was actually a respite, and it was a place where they had safety, they had community, they had people who cared about them versus being at home. So for some of my young ladies, I'm happy they're able to go back into the classroom because they have the structure that's necessary. So when you're talking about mitigating and adjusting, I've had more young ladies suicidal during the pandemic. And I've talked about this with Dr. Hogan because I'm like, why am I seeing my young girls at that particular age, 10, 11? And that has been a concern. And so there comes to candid conversations that you have to be careful how you integrate the parent, because I'm not always sure the role the parent plays in all of these types of things. So I've had to deal with those conversations and follow-up calls a lot to the home to see, hey, just wanted to check in, or hey, I have this lab, or hey,
Right.
You know,
Just to be
that
able
type of
to
thing, just to check in or actually start scheduling return visits. So we're able to do telehealth now,
kind of work
more so than we've
frequently.
done before.
Okay.
So I've had to use different modalities just to see how they're doing. That's been my experience.
How about you, Dr. Hogan?
Quite similar. We were seeing a lot of things. My main concern and the things that COVID is different, but even before, my main concern is the impact of social media
Mm.
in all of its elements, in all aspects of the child health, mental, physical, sexual. It has hit and devastated all three of those areas.
Mm.
Kids are addicted. They are addicted to the phones and the TVs and the false reality of social media. It
Mm.
causes them to disconnect. They
Mhm.
can no longer, eye contact is off the window. They can't
Mm.
express themselves.
Wow.
Then they sit and they feel isolated, and then they eat and they become overweight. And then they're ashamed because they go back on social media and they don't look like the social media, but they can't put the phone down. So it's kind of like it has encompassed every aspect of just like in adults. But the concern for me is that we expect these people to miraculously turn into functional adults and
Right.
one day run the world when they are struggling to a big extent. So during the pandemic, I just have a paper of all these different healthcare facilities, and we just kind of
Mhm.
hand it out because in
Okay.
areas of mental illness, it's confidential. So it's
Sure.
not so hard to get someone to speak to. But
Right.
my main concern just overall that has just heightened is the devastation that is social media. I personally
Mm.
don't believe that like something like this, of course, is good, but
Right.
overall, and the effects of the children, you can't tell me not one platform hasn't devastated them, from Facebook to Instagram to TikTok to Snapchat. It has
Absolutely.
devastated them with more addictive, um,
Mhm.
delusional reality.
Yes. Yes.
Mhm.
Lack of reality,
Yeah,
right?
and
False
lack of
reality. Right.
understanding and coping, and then that leads to suicide because,
Mhm.
oh my God, I can't go out and take a picture at the restaurant, so I'm going to kill myself. Like that whole disconnect, that's not the end of the world, but if that's all you see is your friends going to different restaurants and you can't do it, then
Right.
you're devastated because there's
Exactly.
this disconnect. So that's kind of where we are, like she said, doing a lot more counseling, doing a lot more talking to people, and having just a lot more visits that when I walk in, there's like this weird like headache or chest pain. And I've known these
Mhm.
kids all their life, and I know there's more to that. So
Right.
just having more of those visits.
Okay. And Dr. LeCount?
I think I have had just real honest conversations with parents about limits. You
Mm.
know, you need to set limits. There's some
Mm.
studies that recently came out that said over 2 hours a day, and even 2 hours a day is a lot, but two
It's a
hours a day for
lot.
adults and for children is way too much and increases the risk of
Mm.
anxiety and depression.
Wow.
And so I have tried to implement that as a parent, as well as encourage my other parents. And it's not easy, especially if you're working and you come home and everybody want to talk to you, be like, I just need
Yeah.
a minute. Well, you need to decompress in the car and come in. Like I've had to restructure because my involvement in my own children's lives, as well as my involvement in my patients' lives, and being there and looking at them and engaging. If
Right.
you engage them, so my patients know that if they come to me, you know, that one word answer, that yes, no, all
Right.
that,
It's not good enough.
that's not gonna fly in the. So I just let's start all over. And I'll walk out the door and go
Yeah,
come back in and say,
me too.
hi, Susie, how are you? And I'll wait for an answer. And if mama can't answer, like helping, practicing engagement,
Social
practicing
interactions.
listening,
Right.
practice social interaction. And then
Mhm.
we lost that because none of us have lived in a pandemic. And
Right.
but this social media thing is really spiraling our kids. And so I encourage our parents to just step up and have hard conversations and just support our kiddos in the next generations.
Well, fantastic. Well, with that comment, I'm going to support London and say that you have done an amazing job as my
Yeah, she did a
co-host.
good job,
You
London.
did amazing. And I want to thank you so much for volunteering your time and talent to this discussion
Thank
today.
you so much for having
You
me.
have made it something that, you know, people your age can really relate to. So I want to thank you for that. But we have about a minute. So I would like to get some closing statements, and I'll start with you, Dr. Hamilton.
Ask questions, ask questions, ask questions.
All right. And Dr. Hogan?
You only get one body and one mind. So like Dr. Hamilton said, don't be afraid to ask questions. We're here to give you what you need.
Okay. And Dr. LeCount?
And use the right resources. Come to us. And if you don't understand the question the first time that we answer it, then ask it again in a different way, or just be very upfront with us and tell us you don't understand what I'm saying. I don't understand what you're saying, Dr. Khan. Can you say it again? So just be your own advocate and ask questions, and that's how you're going to get the answers and be the best you.
Well, you guys are amazing. I wish I had you guys as my doctor and my own children's doctors. I think I would have been a lot better of a parent if that were the case, but I'll do my best with what I have now. London, did you have anything you wanted to close with?
I just wanted to say thank you for having me, and I actually learned a lot and am more open-minded with answering and asking questions with these three amazing doctors, and thank you guys so much.
Well, this is the
Thank
first time, but it
you.
won't be the last. We look forward to seeing you again. Thank
All
you
right.
all. Have a wonderful night. Please visit the Healthy Heart Nation website. Please like and subscribe on our YouTube channel. Please share this video from the YouTube channel with your friends who have children, aunties, uncles, all those people who would like to be able to communicate better with this age group. We really have to advocate for our own health. And so we have to be able to go through these types of discussions in order to do that. So please, please, please continue to advocate for yourself. Have a great night.
Bye-bye. Okay.